All right. So thanks for joining us for the October 2025 installment of the Rural Health Association's Rural Resource Series. This is a monthly series that highlights practical tools and programs that rural healthcare professionals across Utah may not be aware of, but can access for their patients. Our goal is to strengthen rural health outcomes by connecting professionals with programs and resources that will benefit their patients. You can find session recordings and materials at our website, www.rhau.org/RHAU-webinar-series. That's kind of a mouthful. If you just go to rhau.org, it's in the programs drop-down tab. We deeply appreciate your participation today, and its involvement and participation in those viewing online is what makes this series a success. And we also want to recognize the Intermountain Health Foundation for their generous support to keep the series going. Today's agenda is as follows. We'll go through a little bit of housekeeping. Our first presentation is going to be on Envision Utah, and Laurel will be giving that presentation. Our second presentation will be on Donor Connect, and that'll be Mark and Brady that'll provide that presentation. Each of you will have approximately 20 minutes. There is a 5-minute Q&A reserved for you as well. If we wrap up a little early, that's just fine too. So we'll move into Laurel's presentation. And Laurel joined Envision in 2022 and is very intentional in the early learning spaces as the Senior Early Learning Program Manager. She enjoys brain building essentials with community partners throughout Utah, as well as promoting and empowering the beauty and importance of caregiver-child relationships and nurturing interactions using early learning principles. Her knowledge hails from her wisdom gained working for the state of Utah's juvenile court, VA healthcare system, and Canyon School District. She also has a vast experience with local nonprofits, where she's worked with and advocated for postpartum parents in various roles. A deep thinker and a curious seeker, Laurel is an applied sociologist, finding root causes and solutions to barriers facing families and our youngest Utahns. She believes in the collective nature of solid working networks and relationship building, and even holds a degree in sociology from Westminster University, where she currently sits on one of their boards. She enjoys gardening, hiking, traveling, and home improvement projects alongside her family, and she believes it is her honor to assist our young children and populations by nurturing, empowering, and talking and reading with them, so that the foundation of their lives is strong and secure, helping generations to come. Laurel, the time is yours. You have until 12:25.
Great. Thank you so much for that long introduction. And yes, not Scientology, but sociology.
Yes,
no, you're fine.
I apologize.
It was a mouthful. I also wanted to introduce Andrea, who is my colleague on the project. She's our project coordinator and comes to us about 6 months ago from the Head Start in Utah Valley, and her knowledge and experience has been such a great addition to our project. So she and I are the ones that cover the whole state for Envision Utah's early learning project. So thank you so much for having us here. If you could go to the next slide, Casey. At Envision Utah, we do a variety of things. We're not just in education or early learning, but we also do planning. We do things with like air quality, water conservation, teacher pay, all of those things. We really want to make sure that Utah is a great place to live for now and for generations to come. So every year we survey tens of thousands of Utahns, and we have them rank their priorities. And so you can see that water, this was from a couple years ago, water was a scarce resource and was at the top of a lot of people's brains, but so was cost of living. And then you see education. If you go to the next slide, though, we also have Utahns say, how do you think we're doing? How do you think we're performing in that? And some of this survey work really guides the work that we do. So we couldn't ignore that education is a top priority for Utahns, but that there's something that maybe we could be helping with. So that's kind of where our project came from. We do work in these spaces at Envision Utah, and you can see that kind of the state has things designed for all of these different areas. But next slide, parents are left kind of on their own in those first few years to help to figure out how to navigate all of this. So us and a lot of other wonderful community partners really try to wrap around those services for families so that their children can get the best start at the very beginning of life, or even prenatally. I would love to talk to more families prenatally, because I feel like they're in a place where they might be able to listen and know exactly what to do when that baby is in their arms. Since we're dealing with healthcare today, wanted to specifically talk a little bit about how you can empower families in that healthcare setting. That's different than in childcare and in schools that we work with and in libraries. The concepts are all the same, but we really encourage anyone that's working with families in healthcare to, in whatever dimension that you're working with them, to really do these 4 things: inviting them in to this nurturing interaction, praising them. So calling out good behavior. Everyone has a lot of negative things that are going on in life, out in the world and maybe in their families. And so really trying to praise anything that you see that's positive, and then modeling how to interact with children. Unfortunately, some families don't know this. Maybe they haven't come from nurturing environments or family models that are really positive. And so sometimes these trusted individuals in their lives that they're coming to for healthcare needs are the ones that are going to be the models for that. And then encouraging them to discuss these things with the families and with their children, lots of words and actions and things like that. So what do we know about early learning? Early learning experiences affect nearly everything, really. Our brains grow the fastest during those first 5 years of life, and over 1 million neural connections are made every second. And that can spike up to 10 million neural connections if that connection is really strong and integrated between a parent or a caregiver and a child. So we want to encourage more of that, because that's really how the structure of the brain is built in more solid ways. It affects their social and emotional well-being, the way that they learn, obviously their health and their resiliency. So this is part of why we care about all of this. So unlike many of the other organs in the brain or in the body, the brain is not fully developed when we're born. And that brain growth really does structurally happen in those first several years. So we want to make sure that parents are empowered and caregivers are empowered with this knowledge, because there's a lot of talk about the physical growth of a little body, but not a lot of people are talking about the brain. So we want to make sure that people know how important that is. This is just the synaptic connections, those formations that happen in the brain. You can see 36 weeks gestation, when that baby might still be inside, versus that newborn, it's getting a little bit stronger. Look at how 6 months postpartum, that baby's brain is just lit up. They are learning so much. Those synapses are growing, they're getting stronger. Everything is starting to connect in big ways. And then you can see at 2 years, they're getting more robust, more those deeper connections, that deeper understanding. And I think that's really cool. Here's a video of one of those formations happening. And this is just one. But if we watch it, they start to just really grow together. And keep in mind, 1 million of these are happening every second in a young child's brain. So this is just one, and then they branch out from there and they grow, and it's this beautiful web, really, of what makes the brain so powerful. So I show this to parents a lot of times because I want them to visualize that when they're going, about their parenting or their caregiving with these young children. I just wanted to highlight that because a lot of people haven't seen that. So we really want to make sure that children are surrounded by a language-rich environment. That means from all aspects. If they're at the doctor's office, we want we want caregivers to be talking to them and with them. We want their families to be able to be engaging in a language-rich environment at home and out in the community. We really want children to be seen and heard and nurtured at the community level and at home. And that really does help with their achievement overall in their life. What does that mean? It's really more than just vocabulary, but vocabulary has a lot to do with it. The amount of words that you speak with a child over the course of the first 5 years of life really do set them up for a lot of understanding, and that helps with their language processing speed. So if you think about a kindergartner being given instructions from their teacher, how quickly they're able to understand what that teacher is asking of them, their ability to learn, of course, the critical social and emotional learning that happens in those first years of life, that grit. Early math skills are really honed. That's where it begins, when they're little, and then obviously focus too. We want them to have all of these things so that they can go out there in that big, beautiful world and learn as much as they can. So what does this look like? It really looks like play. Play is the work of childhood, and we want children and families to be able to play together. Casey, if you could go to 2 slides from now. Yeah, that one. We do these quizzes with parents. This is not something you need to use in your practices or in your organizations, but we have asked parents often, how much do you pay attention to what your child is interested in? How often do you talk about the things you see, hear, and do together? And then how do you make interactions last longer by building on what your child says or does? That is really brain building. And we want it to be fun. We don't want it to be a chore, and we want it to be able to be fit into those everyday moments that they already have. We also ask them, are you confident in your ability to help your child's brain develop? Now, this is one that is all over the place. Some parents, yes, absolutely. Some parents are like, I don't know what you mean by that. And so we're really trying to bridge that gap of understanding. For the parents who are very intentional about this, it's just like a great pat on the back. They're doing a great job. Keep up the good work. For the parents who maybe don't know about this, haven't seen this model to them, this is really, here are some great little easy tools and ways that you can integrate into your everyday moments with them for their early learning. And then we also ask them, do they have specific tools and strategies to support that? And can you teach another parent, which is like the highest level, good, better, best, right? Can you teach, do you feel confident enough in this that you can then teach someone in your own life about all of this? Here's a little video down at the bottom. It should be able to play. If you click on the little arrow on the,
you guys may not be able to hear
that's
it.
okay. I can explain if it doesn't.
Okay. Are you able to hear it?
No, that's okay. He is just really talking to his young boy about what that child is seeing. Is the video able to play?
Oh, I don't know why it stopped.
Let's see. He's looking in that child's eyes. Oh, the child looks away. He looks back. That parent is just really highly engaged with that child right now. This is not a long, couple of hour activity. This is just where they're at right now. He's talking, he's actually using a lot of language. He's talking about how it's a circle, the ball is a circle, and that's early math and early understanding. So I just like to highlight that because I think people in general feel a lot of pressure that this has to be a big thing, but really it's a very, very simple concept.
He's going to replay.
When we talk about vocabulary, what do we mean? We in general, adults are very transactional in our language. We kind of do this, do that. What we would love is for that not to happen with children. We would love it to be able to be a little bit more open and explanatory, I guess. So stop wiggling is 2 words. We've all used those commands. Sometimes they're necessary, but in general, we would love it if people could learn how to expand that and add more vocabulary words. You can see just by adding a few more things and explaining what you're doing and why or where you're going after, you've added a lot of vocabulary words, and that over the course of 5 years adds up to millions and millions of words. So we really like to showcase this with parents and caregivers, just to say, look, it doesn't have to be complicated. Just explain what you're doing or ask your baby questions. You can see this is another example. I'm not going to read it, but it's kind of good, better, best. Good, put your shoes on. That's a transactional. But let's get into that more nurturing language environment. And this third example actually says, what we're going to do, but then it says, what are we going to do next? So that's for older children, but definitely highlights how you can get them to start thinking about now and later, which is a great concept that we can build on as they get older. When we talk about vocabulary with early math, that scares parents a lot. If we were to say it like, you need to work on math with your 2-year-old. Well, that's not really what we're talking about. We're talking about using lots of different vocabulary words and ideas that go around math literacy, which is talking about how many, where, when, estimating and counting. If you see something, ask them how tall it is or how wide it is, right? You can give them directions. Kids love directions, like that little stop, red light, green light game is that stop and go game. And then really what is above, what is below, what is under. These can all be used in a playful way, and they can also be used just when you're pointing things out in the world. Same with meal times. It's one of the things that I talk to parents a lot about is mealtime, because everybody generally has that at some point or another in the day. So I talk about snack time, and I'll say, if you have apple slices and cheese and crackers on your plate, count them. Or have them, if they're old enough, put them in a pattern, or explain the difference between what's on their plate and your plate. Or you can talk about textures or colors. But counting really is the basis for all of this. Even if they're too young to count themselves, you start counting for them, and that's how they learn. So this is all early math, and it's really important so that when they do get into that school age, that they're able to really be able to understand what their teachers are asking of them, and they'll feel confident in that. Baby talk versus parentese, just by show of hands on those of you who I can see, who knows what parentese is? Is this like, raise your hand if it's something you've heard of. Okay, so baby talk is really using those, oh good, Zach, way to go. Baby talk is using those silly sounds. Sometimes they're made up words. What we really want is for parents to use the real words but do it in an interesting voice. So say it in that real good fluctuation. Hey baby, that kind of thing. Where are we going today? We're going to go to the doctor's appointment so that we can see Dr. So-and-so, instead of just, either boring, like a lot of adults talk to each other, or making up words that aren't going to translate necessarily out in the world. And with that, I will say, when my daughter continued to call the library the libadody, I did not correct her because it was too dang cute. So some of them we just need to keep and treasure until they grow out of it. And I cried the day she called it library. So it's okay to still have some of those in our vocabulary, but we want them to go out into the world and know the proper terms and phrases as well. Miss Rachel, she's probably not going to play either, but if you know Miss Rachel, she is really good at showcasing that up and down, really high pitched voice, very interesting. So I would encourage, if you don't know her, you can look up some of her videos on YouTube. And then we always encourage families to speak in their first language. The amount the amount of vocabulary they have in that first language and what they're the most comfortable with is always going to be more robust unless they truly grew up in a truly bilingual household. So families are very relieved to hear this. There's a lot of science that is very strong in this, and we definitely want families to know that they are doing their child a service by speaking in their first language. So just want to, and if anyone needs any additional information on that or research, have them reach out to us and we can provide that. Cell phones. We're all living in this world where cell phones have taken over, and we don't want them to. We don't want families to have their go-to thing with their children be to hand them a screen. That really checks the child out from reality. It also checks the parent out if the parent is on their phone and that child is trying to get that parent's attention. You're missing out on those connections. You're missing out on their brain development as those neural connections. If they don't spike because you're not having nurturing interactions with them, that brain is not going to grow in as robust of a way as it might if parents are engaged. So this is twofold. Let's try to keep kids off screens when we don't need them to be on screens, and we understand that that's not always the reality of it. But for instance, in the grocery store is a great opportunity to be able to go and really just try to, talk about like how many limes are we getting or what are we going to have for dinner. So just be cognizant of cell phones. I'm going to have you skip these next two, but if people have questions about any of this, please reach out. I know we're running late on time. If you don't follow the Harvard University Center on the Developing Child, I would encourage you to sign up for their free online newsletter. It gives a ton of great information about what's going on in early childhood, and they're doing a fantastic job of diving deep into a lot of really big topics. So this is kind of what we do. We work with all of these different kinds of organizations and community parts, right? We want that child and that family to be surrounded by great information and great support. And so whatever area you fit into, we appreciate that you are out there and that you are spreading the word that childhood is important and that we can do the best that we all collectively can to help support that family. Okay, so go to the next one. We would love people to incorporate the science behind brain development into however it makes sense in their own organizations or communities. Andrea and I go statewide. We offer free trainings on this. We'll go into depth about things. We definitely do different trainings for child care facilities versus libraries versus healthcare. They're not all the same. And we would love to be able to help you figure out how you could incorporate this well. That's part of our job. And really, if you go, I don't know what the next slide is, Casey. We did that one earlier. And you can skip through these as well. That's just going into some detail. We want all parents to look at what their children are looking at, follow their lead, take turns, so have those serve and return interactions, talk to their children, and then stretch those conversations so that we can have more vocabulary. And those basics really lead into the tool that we use, which is RHAU. Hoping that that's on the next slide. Oh, skip that. RHAU is free. It's non-commercial. It comes in English and Spanish. There's a wonderful app that you can associate multiple children on, or you don't have to. But if you have a 3-year-old that you want to go to the park with, it will give you tips on little things that you can do that are nurturing and engaging and fun. They're just little activities. They don't require you to go buy something at, a big box store and curate this whole, moment. It's the moments you already have. If you're having bath time with your 4-year-old, what could you do at bath time? If you're driving in the car on the way to preschool, here's a few things that you can do. So we're the RHAU anchor partner for Utah, but this is an international organization. And like I said, it comes in English and Spanish, and then it also comes in some limited printed materials in 17 other languages. So if you have any families who speak other languages, we would love to get you materials. So please contact us. Andrea and I work on the early learning team, and then Travis, who used to work with us, now works in our broader education work for K through 12. But everything we offer, like I said, is free. We have lots of different physical materials. We have brochures, we have rack cards, we have posters that you can put up. If you're in a clinic and you have a bathroom that has a changing table, we have a little changing table or a changing chat thing that encourages parents to talk to their babies while they're changing their diaper. Some parents just don't know how to do this. So we really want to get this information out. So please contact us if you would like any of our support.
Awesome.
Thank you.
Well, thank you, Laurel. And any questions? Mark, go ahead.
Yeah, I was very interested in the information you shared about synapse development. And I guess this is kind of a two-part question.
Okay.
When the synapses are developing and those connections are being made, is that kind of like the light comes on and, oh, if I drop something, it falls? Is that kind of what?
It's the beginning of that, right? So I kind of like to explain it in terms of a building. If you build a very strong base of a building, if you're a building architect, right, and you want that base to be as strong as possible so that as you continue to put on those layers of the building, that the building will withstand more, right? And it's going to be more robust and more strong, and it's going to be able to, hopefully ebb and flow with anything, the weather and all of these things, so much like a young brain. If we build a young brain in a really robust and healthy way, and continue to have those synaptic connections be strong, that brain will then, as that child gets older, be able to hopefully have the skills and the grit to get through whatever life hands them. So yes, you're right. It doesn't happen like once, it's those pathways are being built. And when those pathways continue to be built and they get stronger and stronger is really when that understanding happens. Really great question.
And part two of my question, 2-year-old, you mentioned that it's just on fire. Those synapses are popping. How about when a person gets older, like me? Does the activity begin to diminish?
I don't know. That's a really good question. Because I live in the 0 to 5 space, no one ever asks me about as we get older. But I do know it's harder to learn as we get older. It doesn't mean that we should stop learning. And we certainly, me learning Spanish at this age is harder than when I was younger. I will tell you that. So I would say that, those connections get more firm. And then there's also something called, oh, great, Zach, go for it. This is wonderful.
I specialize in like neurofeedback
Perfect.
and like infrared light. So I would say that there's different stages where your brain goes under significant myelination.
Yeah.
And so one of those is when you're a child. Another one is from around like 9 to 12. And then slowly through around like 25. But your brain is still constantly changing, but it doesn't necessarily have a ton of new resources to it. So you can still learn something, especially if it's connected to something you had already learned in those like first 25 years. It's like if you're making those gaps. But some of the research they're doing with like infrared light technology and like plasma work and stuff like that with Alzheimer's and dementia is that they're seeing that you can kind of start rebuilding those neurons and repairing them, where those types of diseases tend to like erode away your neurons. So hopefully that kind of answers what you were asking.
That's amazing.
You're asking.
I appreciate the information. Thank you.
Thank you, Zach. That's great. Yeah, no one ever goes past where I stop. So this is fantastic. I learned so much right then. Thank you.
Well, thank you both for the questions, and thank you, Laurel, for your overview of Envision Utah. We definitely support your team and what you're doing, and do believe at RHAU as well that how you learn matters, and are excited to get these resources out there.
Thank you.
In case anybody didn't grab contact information for Laurel and Andrea, the slides will be posted for this presentation along with the recording, so you'll be able to grab that information from there. We're now going to move to our second presentation, which will be provided by Donor Connect. We're joined by Mark Dixon, who serves as Director of Public Education and Public Relations for Donor Connect, and the organ procurement organization that serves Utah. And he is joined by Brady Dransfield, who manages the public education. So Brady and Mark, the time is yours, and you'll have until 12:50.
Great, thank you. Appreciate very much the fact that these kinds of opportunities for presenting different types of organizations exist. So thanks, Casey. The very first thing I want to do is just kind of give an overview of what an organ procurement organization is. That's what Donor Connect is. We are an organ procurement organization. Some people shorten that to be OPO. And OPOs basically act as a bridge between organ donors and transplant recipients. And so we work with donor families, we work with hospitals, we work with transplant programs, and our whole reason for existing is to try and facilitate successful donation and transplant matching processes. And so Donor Connect has a number of different departments under the umbrella of the OPO. We provide professional education. That means that we develop relationships with hospitals, and we help hospitals understand policies and procedures, and we inform healthcare professionals about the donation process. There is a great deal of coordination that needs to happen with hospitals, and it's not just the large hospitals. It's small hospitals that may be in rural parts of the state, and regardless of whether or not you're a transplant center like the University of Utah or Intermountain Medical Center, or if you're a small regional hospital in central Utah, there's information that they need to understand and know in order to contribute to the transplant and donation process. That's what professional education is about. And then we have what we call the aftercare team. They provide compassionate care, they provide grief support, and they basically serve families that whose family members are donors. This is during and after donation. We provide clinical support to donors to ensure their organs are medically suitable for transplant. And then we have a whole department that's dedicated to community education. And that's what my department and the involvement that Brady has, that's what we do at Donor Connect. We're involved in the community education process to help people understand what donation is all about and help people to make informed decisions, including, should I be part of the organ donor registry or not? We currently have about 60% of Utahns that have said yes to donation and are part of the organ donation or organ donor registry. And then there's a significant number of persons, about 40% in the state of Utah, who have made the decision not to be donors. So that's an overview about what an organ procurement organization does. And I'm going to turn time over to Brady to kind of handle the information that's on this particular slide.
Yeah, thank you, Mark. For the majority of these bullet points, it sounds like Mark has covered most of these, but I wanted to go in depth a little more on bullet number 3, where we provide the support, the aftercare, and also work closely with the community. For example, we have the opportunity, we work closely with the driver license divisions, where we find a person, a family that has lost a loved one, and we honor that loved one by mounting a plaque within the driver license division So when you go in there, you see this plaque. It's poster size, tells about their loved one, what happened to them, and a little more inspiration of, hey, become an organ donor, and this is kind of the effect, and this is what happens. So someone's worst day turns out to be someone's best day. In fact, yesterday we were at the Springville driver license division, had the opportunity to do an unveiling with a plaque. However, we also had the recipient, the heart recipient of the loved one who lost their loved one, was there, and they were able to unite and meet each other for the first time and share stories about their loved one, what it meant to them, and so forth. And we also are out in the community. We visit with the middle schools and high schools, and also events out in the community where we talk to students about the importance of organ donation, what that means, and some of the myths and rumors. We break down and discuss those. So gives them a better education on when they sign up to become a driver, they know a little more about organ donation, and give them the education to make that decision.
And I would add, I'm sorry, Brady,
No,
I would just add that that's really when we are making presentations to whatever audience we happen to be interacting with, the encouragement, the emphasis in those presentations is to have a conversation with your family so that one's wishes can be honored. And, we do want to provide education about the donation process and how it works. But ultimately, the goal is to encourage people to have a conversation with their family, especially kids. Brady mentioned this program in schools, and we're talking with health classes when kids are in junior high school. We're talking to driver's education classes when they're at the high school level. And again, the message is have a conversation with your family and let your parents and loved ones know what you want to do in your life. And I think we can go to the next slide. Here we go. Brady, do you want to cover this?
Yeah, sure. So this is a number that it's kind of an eye opener for a lot of people as far as people waiting in the United States on the waiting list for waiting for an organ. There's about 118,000 people, and here in Utah, over 1,000 people are waiting for the gift of life. And there are about 64% people that are signed up to be organ donors. And a big percentage, I would say about 80 to 85% of those people on the waiting list are waiting for kidneys. So Utah is a very generous and giving state, which has proven that our numbers are a little higher because of that fact. And we all have 2 kidneys. So if you're willing to receive a kidney, why not sign up to be a donor and make a difference? So in 2024, we keep on, these are the numbers we hit. We continue to break records as far as organ transplants. We've continued to do that year over year. And that's because of the growth and the need, and also our team and people willing to be donors. So that has helped across the state of Utah.
And I'm going to add one other point. About 95% of persons, when surveyed, will say, "Oh yeah, donation. I support that. Donation is a great thing, and I'm supportive." Yet, 64% are registered, and so therein lies a great opportunity. Why aren't the segment of people between 65 and 95 people, why haven't they signed up? Why aren't they on the donor registry? And that's where there is an opportunity for us as an organization to help educate. Often there's a lot of myths surrounding donation. Some people think, well, I'm too old. Some people think, well, I'm not healthy enough. I've got problems, and so nobody wants my organs. And that prevents them from signing up. And we encourage people to just sign up and then let a doctor, let a medical professional make the determination if the time comes as to the viability of your organs. All right, Casey. This is really a great story that we're proud of. And assuming that it will play, I would really love to show this video to all of you.
So I've got it queued up. If it's one of the videos you sent me, I've got it queued up on another tab if it won't play.
Yeah, let's give it a try. Let's give it a try. There we go.
Okay. So is this the two that you sent me is one is First Meet Ashley and Gina or Gina?
Yeah, the one that I'm seeing right now, the Tay little girl with the green sunglasses. If we could run that would be terrific, Casey.
Yeah, not the First Meet link.
Okay. Let me share the right thing here. Google Meets is funny about the way that it shares things.
Yeah. And you know what, Casey, if for some reason, yeah, there we go.
Can you hear that?
No, unfortunately we can't hear it.
Let's see. Let me try one more thing. Forget it. Oh, this is the one I'm gonna do. Let's see. I think this is the way that you share that it works.
She's like the perfect little girl.
Good.
She loved dancing and singing and playing with her brothers. JJ, what you doing?
I'm hugging hers.
Our daughter passed away 3 years ago. She was in a horse riding accident, and she received a traumatic brain injury.
Riding horsey.
This is what you wanted to do today.
Yep.
She really wanted to ride her horse that day. A car came up the road and spooked the horse, and Taisley fell off and hit her head. I called AJ. He was at work, and he came as fast as he could.
So I got there and seen Taisley on the ground, and after that, my world just stopped. It was like slow motion. Sorry. It was just, if you don't think your old kid's gonna die.
It was chaotic at the hospital. They were so amazing there. Primaries is, I can't say enough good things about that hospital. They're incredible. I think we were there 24 hours before they pronounced her brain dead. And so during that time, they let all of her family and visitors come and see her and give us support. We had counselors helping us. We were ultimately just trying to make the decision. If she doesn't come out of it, what do we do? And trying to make that decision to donate her organs was really hard. Because it's not the way you picture saying goodbye to your child. There just wasn't anything we could do. So we decided to help as many people as we could by donating her organs. We just knew that if Taisley had a say, she would want to help as many people as she could. And so that's why we did it. To help all the other kids and all the parents so they didn't have to go through what we were going through. We've written letters to all of the recipients. Her heart recipient, we're actually really good friends with now. We were able to meet them. He's the cutest little boy in the whole world, and he calls us his heart mom and dad. And we just love them. They're the sweetest family. They're in Utah, so it just makes it easy to talk to them and celebrate birthdays and holidays together. And they're so sweet. They always remember Tay. The first time we met, they brought a stethoscope and we were able to listen to his heart, and they gave us a Build-A-Bear and they got her heartbeat from the hospital and put it inside. And so that was really special. From the moment we decided to donate organs, we just wanted to stay connected. That was like a part of us, a part of Tay. And so we just sat on pins and needles till we got our first letter. And we were so excited. AJ was out of town when we got it. and they sent us a whole packet of letters from their entire family. They're just so grateful that we gave them the chance to let their little boy live. I'm just so grateful we got to be Taisley's parents and the example she was to us and the impact she's made on so many other lives, and make it worth something, you know? I don't want her to be forgotten.
We're not the heroes.
Yeah, Tay is. Tay's a hero.
So it's, it's easy to give an overview with stats and numbers and figures about what we do and all of that we've done up to this video. But the video really encapsulates, I think, an overview, the big picture of what Donor Connect is all about. And so I wanted to share that with you, and we can move on to the next slides. So let me share with you just a couple things that are very important to us right now. First of all, I'll share with you the fact that there are changes that are taking place at the Centers for Medicare and Medicaid that can potentially disrupt the system that is in place right now. I don't know if any of you have seen some of the stories that have been in the media recently that cast some doubt about the integrity of the donation and transplant system. If you haven't seen them, I'm glad. If you have seen them, though, you should know that there is an effort to try and disrupt the organ and donation and transplant system. And so our concern right now is that there could be some rule changes that disrupt the system. And so that's an advocacy issue that we're involved in right now. And then we can go to the next slide, Casey. Another issue that I would share with all of you is the fact that there is right now modernization taking place in the electronic referral system. That is important because, as I mentioned a little bit earlier, hospitals throughout the state, whether they're transplant centers or not, are involved in providing referrals and providing information to our teams on the clinical side here at Donor Connect about people that could potentially be organ, tissue, and eye donors. And so this modernization that is taking place, in fact, I believe right now, even as we speak, there is new systems that are being introduced at Intermountain Health, even as we speak. And so this is of great interest to us and to medical practitioners as a whole, so that there is better, more effective and efficient communication that takes place between the various entities that have concerns for people in the hospital. Let's keep going. Some other opportunities that I would mention is right now, the primary pathway for people to become part of the organ donor registry is through the DMV. You go to the driver's license office, and when you're filling out either a renewal or an application for a driver license, you have that opportunity of checking a box and saying, yes, you'd like to be a donor. We are actively looking for and encouraging, both at state and federal levels, new opportunities for people to be able to register as donors. And then the final thing, if we can go back, just one other mention here, and I kind of already mentioned it. There's a lot of people that for some reason have in their minds that they're not eligible, or that for some reason the system is compromised, or in other ways not safe. And we are working very, very hard to try and dispel rumors and promote truth and bolster up the credibility and legitimacy of the organ transplant and donation system. Why it matters in Utah. Well, particularly that top bullet point there on the left-hand side, rural and underserved communities face unique challenges. And Casey, I'm sure you and your organization are well aware of that.
Mhm.
And I would just say that Donor Connect is too. And we're making very deliberate efforts to serve rural communities in Utah. We've got efforts right now among the indigenous people in the Four Corners area. In fact, we have a meeting with the vice president of I think it's the Navajo tribe in early November. So there's a lot of efforts that we're doing there. So Brady mentioned the fact that Utah is a very giving state. And so there are lifestyle and cultural dynamics that we're able to leverage here in Utah because of the very giving nature of people in Utah. That has allowed Donor Connect to be among the top performing organ procurement organizations in the country. And then the other points here, Donor Connect leads with cultural competency and outreach and innovation. And I mentioned the fact that we've got very, very high performance records and metrics that show that we're doing a great job in serving Utahns throughout the state. I'll open it up for any questions and feedback.
Mark, what's the best way for folks to get a hold of you, organizations that want to work with you, or people who have general questions?
General questions. If you want immediately somebody to pick up and say, hello, how can I help you? Our phone number is 801-521-1755. The following slide, I believe, or two slides from now, has email addresses for both myself and Brady. And we can skip this. There's our contact information. And we are happy to enter into whatever dialogue we can enter into that would be of service to other organizations or individuals that are interested in donation and transplant.
Well, we're running low on time. I'll just say, as the father of a child that's received a kidney transplant in the last 6 months, the work that you guys are doing is life-changing. And I know it's not easy. It's not easy for me outside looking in, watching that video and feeling that. So there's a lot that goes into this, and I appreciate the effort you guys are putting forth, and appreciate that you recognize that we do face unique challenges in rural Utah. We got transplanted in California, and we're fortunate enough that Life Flight was able to fly us out there. So it was only about an hour and a half to get out there. But had that not been the case, it would have been an 11-hour drive out to the transplant center from rural Utah to get that transplant. So appreciate that you guys recognize those dynamics, and we're here as an association to support what you're doing as well.
Thank you.
Yeah. So thanks again to all of our speakers and those of you who were able to attend today. Your support for the series is critical, and we just want to highlight that this last slide. The next session is November 6th, same time, 12 p.m. The November session is going to feature a presenter from Bear River Mental Health. It's going to talk about mental health resources and challenges for maternal mental health. And talk about their work in areas like Box Elder, Cache, and Rich County. This is a service that is only available in a few places in the state, and they're working to build awareness to help spread those services. And we'll also have a presentation from Molina Health, who will talk about the work that they do in the community to help the support as well. You can RSVP for this session using the QR code on the right of the screen there, or you can go to our website and register there for any of our sessions, as well as view all of the information and previous recordings from other sessions. We do want to note that we have one spot left for our speaker series in December. So if there's anybody that wants to get in and be a part of that presentation, or take advantage of the opportunity to be part of our presentations, you can find the registration link on our website to apply to be a presenter as well. Thank you all for attending and for providing this information. These are both phenomenal organizations and resources, and we'll end there, and appreciate everybody, and see you all in November.
Thank you.